All right, Suheilah, you can go forward.
Okay. Thank you. Assalamu alaikum wa rahmatullahi wa barakatuh, family and friends. Ramadan Kareem. I hope everyone is doing well and staying healthy and safe. We hope you had a blessed and beautiful start to Ramadan, and I hope the rest of the month continues to bring us more blessings to you, your loved ones, and to the rest of the world. Our topic for discussion today is coping with COVID-19, and we have, alhamdulillah, 3 members of our community who are here to share their expertise and experience with us. We have Dr. Kawthar Yusuf. She is an emergency department resident. She was born and raised in Northern Virginia. She received her Bachelor's of Science in Neuroscience from George Mason University. And then she received her medical degree from Virginia Commonwealth University in 2018. She's currently a second-year resident and she's training in emergency medicine in Washington, D.C. So mashallah, welcome, Dr. Kawthar. Thank you. We also have Kamal Ahmed, who is a licensed psychotherapist. He's also the founder and operator of California Rooted Counseling. He works full-time at the local jail, and then he works where he works individually and with groups. He has his Bachelor of Arts degree in psychology from San Jose State University and his Master of Counseling degree from Sophia University, also known as the Institute of Transpersonal Psychology. Our third speaker is Maha Saidosman. She is a nutritionist. She works at Alta Bates Sutter Medical Center with renal and cardiac patients. Her Bachelor's of Science is in nutrition. So welcome all 3. Thank you guys for being here. My name is Suheilah Abdalla. I'm a registered nurse. I work in the neonatal intensive care unit. That's my specialty certification. I've worked all over though with peds, pediatric ICU, and maternal child health. So with that, we'll have Dr. Kawthar take it away.
Assalamu alaikum. Thank you, Suheilah, for the introduction, and thank you, EMC, for letting me talk with everyone today. So let's just dive right in and chat about what's been going on with COVID, or SARS-CoV-2 is what the virus is called. What do you guys think has been going on as far as symptoms and what to look out for? Come on, Suheilah and Maha.
It can get you can get it quickly by interacting with any patient who are COVID positive. So you have to maintain social isolation or social distancing.
Yeah, great. So that's very important, and one of the big things that I'll be talking about today. Like in general, it's kind of hard to actually get all the data right now just because we're living in real time of what's happening. So it's kind of an exciting time in medicine, although unfortunate, of course, but very interesting. So the symptoms are mainly seeing no symptoms, so that's tricky. But a lot of times it can actually be fever, chills. I think the CDC finally had added headache, and as well as loss of taste and smell. But initially it was just the 3 of fever, chills, and shortness of breath and cough. So right now what we're seeing is it can either be a very like vague, mild presentation, or it can actually turn into the worst, where it initially is like calm, maybe looks like it's going away, and then all of a sudden you become very short of breath, have chest pain, and have pain with breathing. And you tend to see those people come in around 5 to 10 days of their symptoms. And I'll talk a little bit more of what I've been seeing as far as patients go. But the risk factors that we have been obtaining from either from New York, that's like been the big hub in the United States. There was like a study, essentially it was a retrospective study that looked back at 4,000 patients, and they saw what their risk factors was for death. And it was about age. So age greater than 75 at a much higher risk of dying if they had a BMI of greater than 40, if they had a history of heart failure, and if they had come into the hospital with an oxygenation level of greater than or less than 88%, and normal is 95 to 100% on room air. And a risk factor that I've been seeing anecdotally in the ER is men having a higher risk than women in general. The theory behind that is that women who are premenopausal tend to have a protective risk factor from their endocrine hormonal system, essentially, protecting them from from getting any cardiac disease. And the way that this disease is killing people is actually at the end is usually due to the heart. It starts with the lungs, but then it eventually will have your heart stop, and called cardiomyopathy. And essentially women tend to have a little bit more coverage on that, and premenopausal women. So I tend to see women who have coronavirus, but I end up discharging them, and men who have coronavirus as well, but they just are needing oxygen and need to be admitted. So those are one of the other risk factors I wanted to stress. As far as children goes, you know, on the news, the news like has a lot of dramatization to what's happening, and you always hear about it when one child dies. I looked at a retrospective review for children, and they reviewed greater than 2,000 patients that were under the age of 18, and 90% of them were asymptomatic, or they had mild symptoms. And then 13 cases were critical, where 7 of them were less than 1 year old and were critical illness presentation, which is uncommon. So usually kids tend to do okay. Those that seem to be really, really sick are a very young age. So Suheilah will be talking about that as well. So, you know, I think that's why it's a great thing that we stopped schools for a while, because I do think that they were a great vector, hiding and carrying the virus and bringing it to adults who are more vulnerable to the situation. But just to move on, like, so what do we do during this time? How to kind of protect ourselves from this virus? Number one, you know, if you are a smoker, you should stop smoking. If you know, are large or obese, maybe this is the time to try to lose weight, change your diet, encourage vitamins. There's been some studies that recommend vitamin C. I think that went off the charts. You can't even get it on Amazon anymore. And then vitamin D and zinc have been recommended as well. Another thing that I kind of picked up to be prepared for what could happen if you do get sick is maybe obtaining a pulse oximeter. So it's a little fingertip machine that you could put and measure your heart rate and the oxygen level at the tip of your finger. And I do think there are some iPhone apps that are actually reliable, because we've tested it in the ER. And essentially, it's important to know what your oxygen level if you do have this disease. So if you're walking and you have it on your finger, you usually do a 6-minute walk is what studies show. And, you know, if your oxygen level is greater than 94% or so, then you're okay at that point, because I do think part of it plays a role when you are told you have coronavirus and you only have maybe a headache. People kind of, I think, anxiety hits in, they hear and see what's in the news, and I end up seeing people who come back to the ER like 2 or 3 times after being told they have coronavirus because they're feeling short of breath, but lo and behold, maybe it's actually just anxiety and their oxygen level is okay. And Kamal will be talking about some more of that. But so another thing that's important is proning. So what is proning? Proning is when you're laying on your belly or laying on your side position or other side. A lot of us, when you're sick, you end up just laying on your back and you don't really want to get up or do anything, especially if you have like body aches, fever, and all that. We've noticed in the ER that if you end up giving them some oxygen just by nasal cannula, and you have them lay on their side or lay on their belly for a couple hours and then switch their position, that actually helps, and it decreases their risk of getting intubated. I don't know if you guys know about the mortality rate, but if you get infected and you get admitted to the hospital and you get intubated, the mortality rate is about 80% in China, 88% in New York. So, you know, if you get intubated in the hospital, you're not likely to make it, essentially is what I'm saying. Not just to freak you guys out, but that's what the data is showing. So we're trying to avoid intubating people. So we just try to change them in positions and try to actually get them to be wherever they're most comfortable. And they'll actually realize, actually, I feel like I'm breathing a little bit better this way. As far as what the president recently recommended, as far as self-injecting disinfectants, no, it's not a thing. Don't do that. That'll just you'll end up in the ICU for that too. So, and that causes cancer. So I don't know why he would recommend such a thing, but anyways, so lastly, the most important thing is social distancing. You know, if we look back into our history of 1918 of flu pandemic, which was an H1N1 presentation, yes, it did come back. It started in the spring, came back in the fall, and then into the winter. So there were like 3 waves. They said the second wave was the worst. And essentially, at that time, it was because people got tired of social distancing. And then there was a thought of maybe the mutation of the virus occurred to where if you were immune, maybe you didn't get infected, but those who were not infected prior to the first wave, the second time, it ended up being more deadly of a virus. Not saying that this is what's going to happen with coronavirus. We don't really know. It's hard to tell. We're a few months behind other foreign countries. But, you know, the only way, honestly, that we would be okay is if we had an 80% herd immunity. And that's when society can really get back. And a herd immunity means that about, you know, 80% of this country are immune to this virus. So then that 20% are actually who've never been infected, who are not immune, they're safe to be in society, and that 80% is protecting them to where the 20% are not always together, and they kind of like protect each other essentially. Now, you know, we're still trying to even get tests for people, not only just antibody serology testing, but just regular tests to see if people are infected, and that's a big issue. And then serology testing and how accurate they are is another thing. As far as we know, the infectivity rate is about 6. So like one person gets sick, they can infect 6 people, and that's why this grows exponentially. And because we're social distancing, the idea of that is to flatten the curve, decrease the amount of masses of sick patients into the hospitals and overwhelming the system. So we kind of want to just balance this out. And we can also kind of decrease the amount of deaths as well. So the idea of all of that is, you know, with social distancing, I think a lot of people nowadays are seeing where people want to get back to society. And the question is not really when can we get back? The question, you know, just listening from all these podcasts about epidemics is more so about how can we get back? And how can we get back is by having more tests, having definitive serology tests to see if, you know, these people are safe to go back into society. And then as well as, you know, getting a vaccine at the end of the day. And that may take 1.5 years, and I'm not necessarily saying it may take 1.5 years to get back to life, but, you know, this may just take some time to really just get back into society essentially at this point. But at the end of the day, what we're doing is honestly just going to save more lives and allow us to get back to society when we're more comfortable and safe. Yeah.
Thank you so much, Kawthar. We're gonna move on to Kamal. You wanted to add anything to that?
Assalamu alaikum, everybody. Ramadan Mubarak. Can you guys hear me?
Yes.
Yes, we can hear you.
Okay. Cool. I know my mom's watching, so I want to say hi, Mom. And my little brother, Adam. So basically, I had a few things that I wanted to address, but I didn't want to bore you guys with, you know, jargon. I just wanted to really have a conversation. But what are the first things you guys noticing, or like you guys up here with me, like what do you guys notice comes up for you during this time?
Fear, because it's a new thing. We don't know anything about it. And a lot of people are just very scared.
Okay, fear. What else?
Uncertainty, feeling out of control.
Okay.
Tired. Want to go out.
Yeah.
Yeah. So itching to go out. Yeah. So I had 5 things that I wanted to cover. One was isolation from others, anxiety, mindfulness, affirmations, and resiliency. And then I have a little homework assignment for everybody who's watching at the end. So I'll just bring that part up later. But isolation from others. So I think it's important to keep in mind that social distancing is not the same as emotional distancing. And because we are separate from our friends and our family, some of us, our family, it doesn't mean that we have to be disconnected from everybody else. So I know it's not ideal to, connect through Zoom or FaceTime, but that is an option. And that's an important option to keep in mind whenever we do feel like we're lonely or we're feeling isolated from the world. So that's going to be I have a little homework assignment at the end for that. Second piece that I wanted to talk about was anxiety, and particularly for the young people who's watching. If you got young people in the house, bring them on in to this conversation. But this applies to also adults and grown-ups too. But I think, especially for young people, our young people right now, we're not going to school. We're not physically going to school. We're getting homeschooled. We're going on Zoom and learning that way. And I know some schools, they have, a couple hours, 2 or 3 hours a day versus 6 hours a day. So then that kind of, throws a wrench in the whole family system as well, because what are they going to do with all that free time? So one thing that that I think is important to take note of is structure. And if you guys as a family are talking about this new normal that's happening right now, I think the sooner you have that conversation, the better, because there's experts saying that this thing is not going to be over until like 2021. And yeah, it sucks to hear that, but the sooner you can face that reality or that possibility, the easier it is to actually adjust and to create structure that will last you throughout this whole thing. And when I say structure, I don't mean more so like, creating structure of like, this is what I have to do, like a to-do list, or this is what I should be doing. But instead, tap into your body, tap into your feelings, and ask yourself, like, what's going on? What do I need right now? Because when we wake up in the morning, when I roll out of my bed, there's times I'm just hungry, and sometimes I'm just super tired. And sometimes I don't feel motivated to do what I already set myself to do for that day. So it's okay to have a structure, and then also to be flexible with that structure, because this time that we're living in right now is really can cause a lot of stress, and you don't want to add more stress onto your life by not fulfilling your commitments or your schedule or your routine. Another thing to help with structure is to have your home your world. So what that means is like, your home is not like your home anymore. It's actually your whole world. So if we're doing shelter in place, you want to be creative about how you maintain your house. So for example, for me, like when I used to work out, I used to go to the gym a lot. I don't have a chance to go to the gym. So I have to create a space to actually work out. So for me, I have a balcony, and I had to clean up the space with my wife just to be able to work out and get some fresh air. And, your kitchen can be the restaurant, but you just got to be creative about how you utilize each space in your room, in your house. And hopefully that will help you sustain some structure. So that's the second piece. That's the anxiety piece. But also I wanted to add that to take pauses in the moment in your day. So like I said earlier, what do I need right now? Tapping into your body, and we are fasting right now too. So not only are we feeling isolated, but we're also feeling hungry, and we're also feeling tired. So acknowledging those things during this time can actually help reduce the stress. So it's okay to feel hungry. It's okay to feel tired. It's okay to feel lonely. Just acknowledge that. And you want to ask yourself also, like, you know, how can I meet that need for myself? Is there people around me who can meet that need for me? So if I'm feeling lonely, how can I feel less lonely? Is there someone I could talk to? Do I have a close friend that I can reach out to? And another piece is mindfulness. So I don't know how much of us know about mindfulness, but right now we're really, you know, facing ourselves during this time, and we're facing our demons, and we're facing all our insecurities. And, you know, a lot of times we get in a habit of distracting ourselves from ourselves, but now it's like we're facing ourselves and there's nowhere to go, you know? So I think a good thing to think about is actually living in the now, living in the present moment, because we don't know what's going to happen. We don't know what the future is going to hold. And all we really have is now. So what mindfulness is living in the present moment, living in what's happening right now, not being focused on tomorrow and not dwelling on what happened yesterday. So one technique that I like to use with my clients is called, or I call this 4-4-8 breathing. You guys want to try it out?
Yeah.
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 All right, cool. So the idea of 4-4-8 is you breathe in for a count of 4, you hold it for a count of 4, and then you exhale for a count of 8. So let's do this together. Let's go like a few rounds. And if you're watching at home, feel free to participate. All right, so you guys ready?
Mm-hmm. Yes.
Yes.
Okay.
Yes.
So I'm gonna, on my cue, we're gonna start breathing in, okay? So ready, breathe in. Holding it for 4. And then breathing out for 8. Really pushing it out. Let's do it again. Breathe in. And blowing it out. Let's do it one more time. Breathe in. Hold it. And then breathe out. Try to really push it all out till we get to 8.
Oh boy, that was very helpful.
Yeah. Already, yeah.
Thank you.
I actually do that sometimes before going to sleep, to fall asleep.
Yeah, yeah. So the important part is the exhale. So we want to make sure that the exhale is longer than the inhale, because what happens is when we exhale longer, it actually activates the parasympathetic nervous system inside our body, which actually helps us calm down. So whenever we're feeling ramped up and anxious, we start breathing shallow breaths, like, right? But when we slow down our breathing and we exhale longer than the inhale, then actually we start feeling more calmer. So that's one thing you can do to actually help yourself when you're feeling stressed out. You know, you want to use this when you're feeling a stress level at a 6 or a 7, not so much when you're at an 11, you know, because then you're already past the point of coming back to feeling all right. All right, so the second to last thing I want to bring up is affirmations. I don't know if you guys know what affirmations are. You guys heard of it?
Mm-hmm.
Yeah, so words of encouragement. You want to talk to yourself, because our mind could really, you know, trick us. It can make us feel happy. It can make us feel sad. It can make us feel mad. But the thing is, we have power over our mind. So you want to feed it positive messages. You want to feed it hopeful messages. So a few affirmations that I came up with was, this too shall pass. You can tell yourself that this too shall pass. This pandemic won't be forever. Another thing you can say to yourself is, we will get our normal back. We will get our normal back. Another thing you can say is, Allah is in control. Allah is definitely in control.
Mm-hmm.
There's a lot of things that we think we're in control over, but we're not. So this could be a helpful reminder. And obviously we're all on different levels of deen and spirituality and religiosity, but that's something that helps me get through it. And another affirmation you could tell yourself is, we will get through this. So, which leads me to my last point, which is resiliency. So I think it's hard to actually like think about this future that we could have, because we're stuck in how crappy our situation is right now. But I also want to encourage you guys to think about how resilient you are. And if you're a student watching this, if you're a professional watching this, if you're a parent watching this, you are resilient. You've had to overcome a lot of challenges, and you've had to overcome a lot of barriers. A lot of our parents actually, came from back home, and it wasn't easy. So they're resilient just by that. My dad came, with $20 in his pocket. Resilient. So remind yourself of how resilient you are, because that's going to help you, or that can help you get to feeling more hopeful. And you know more than you think you know. So that's why it's important to reflect on this and remember all the things that you've overcome, because you've overcome it. So that will help you, or that will remind you that you have what it takes to overcome this pandemic. So the last thing is the homework. So I got some homework for you guys. Every time someone calls you, don't let it go to voicemail. Pick it up. Don't say, I'll call you later. Don't play phone tag, because phone tag sucks. You'll thank yourself when you pick up the phone, and you'll just have a stronger connection with your friends and your family. So next time someone picks up, or someone calls you, just pick up and just see how they're doing, and they'll check in with you too. Because the whole thing is about isolation, right? So we kind of get into this rut of thinking that, okay, since we're isolated, we have to be isolated, but no. So that's your homework. So staying connected with people who give you a call.
I'm just saying, yes, we should.
Yeah. And that's all I got.
Thank you so much, Kamal. That was super insightful and helpful. Maha, would you like to speak? Add anything to that?
Yeah, well, thank you so much, Kamal. That was very helpful. And thank you for asking me to be in today. It's such an honor and privilege to talk to you guys about something that is very deep into my heart, which is nutrition. So as Kamal was just saying, it's this time is very stressful time. We all stressed out. Many people have lost their job. We are in such an uncertain time. We don't know what are we going to do next. When is our new normal going to happen? We don't know. Everything is just shut down. So I can understand how stressful this time is. But the one thing I want to talk to you about is identifying physical hunger versus emotional hunger. So when let's just say there are two things I want to talk to you about. First is how to maintain healthy eating while social distancing. And with that too is identifying physical hunger versus emotional hunger. This time is stressful, so we don't have to eat to soothe our feelings. So let's just say you ate something, 10 minutes later, you're starving, you're hungry. You just need to pause and ask yourself, am I really hungry, or am I bored, anxious, happy, whatever the feeling might be? So really always ask yourself that. I'm the type of person who usually prefer having 3 full healthy meals because once I do that, the tendency of wanting to snack, I don't feel like I want to snack anymore because I've already had 3 healthy meals. But if you're the type of person who do like to snack, just please remember, just keep healthy snack around. There's a lot of options. Nuts are a good option. If you want to have apples with peanut butter, plain yogurt with some fruit, cheese stick, halal jerky, that's always good option for all of you guys. Another thing I want to talk about, as we're practicing today, the social distancing, we have been told to avoid going to the grocery store as much as we can because there's a lot of people there. So you wanna be a good citizen and practice that. So only one person in the family should go to the grocery store. And when you go to the grocery store, please take a list with you. Just don't hoard food. Don't get extra stuff. Just take a clear list of what exactly you need to get and stick to it. You know, you don't need to buy food for your neighbor or your coworker or someone or your niece, your nephew or kid, whatever. Like the only people you are responsible for is A, yourself, and B, everyone who lives with you. So try to stick to getting exactly what you need. You don't have to make a recipe or like use a grandma recipe, your mom's recipe. You just need to eat food for fuel. Also, if you're gonna, this is another thing, if any of you guys don't get anything from this, just remember this one thing. When you do grocery shopping, please read the ingredients. The first 3 ingredients, whether it's a cereal box, whether it's oatmeal, yogurt, pasta sauce, whatever it might be, the first 3 ingredients should not include sugar. Sugar is sucrose, example like sucrose, maltose, glucose, dextrose, anything that end with OSE is sugar. So avoid getting those all together because it's probably, if this is the thing, probably like 3/4 of it full of sugar is only 1/4 of it have like healthy food. So just avoid getting those items. Also, since we are home all day, you know, I don't really have a big house, but it's like for myself at least, I can see myself like going from my bedroom to the balcony, downstairs, outside, walking outside, and then to the kitchen. And it's so easy for us to just eat some of this, some of that, a grape, an apple, peanut butter, brownie, whatever it is in the house. So just practice mindful eating. Watch what you do. So what I found to be very helpful is keeping a food journal with you. So maybe if you wanna watch what you eat, in the end of the day, just write down everything you have eaten. Just nobody is going to judge you, nobody's looking, this is just between you and yourself, so you can track your calories and you can know what are you consuming throughout the day. And I've noticed, you know, right now there's a lot of new Netflix shows and Hulu shows, and a lot of us are watching TV and we're eating and watching TV. And that's a big problem because we're going from this hand to mouth motion. We're just stuffing our face and we're not paying attention to what the food we're eating. So please practice mindful eating. That when you eat, just remember, this is the time. It should be a calm environment. Shut off the TV, shut off the phone, be present. If you talk with your family, to your kids, to your spouse, just be with them and just give time to the food. I mean, we are so lucky to have what we have right now. There's so many people around this globe are hungry, especially this time of the year. So just please remember, just mindful eating, be present when you eat. You know, for me, when I eat my meals, it's my personal time. It's my time. My family, no, I'm not going to pick up the phone. I'm definitely not going to sit down and watch TV. Of course, do I do it sometimes? Of course, I'm not going to lie, but I honestly do try. I'm sitting on the table. Nobody saw. Either you want to sit down and talk to me, go ahead, but I'm not going to pick up the phone. I'm not going to go downstairs, open up the door. This is my time and I need to be here. I need to be present. Someone told me in the past, another point I want to talk about, someone told me in the past, oh, I can have a bowl of salad and it's 0 calories. And that's not true. Everything have calories. Every little thing you put in your mouth have calories. The only thing that doesn't have calorie is water. But you know, if you have salad, if you eat in a bowl of salad, just be cautious of the salad dressing you put in, any cheese, dry nuts, crouton, whatever you put in, everything have calories. So watch your caloric intake. So that's the first portion of things that I want to talk to you guys about. The second portion, now that we are fasting Ramadan Barak to all of you guys, the one question that I get from a lot of people is, I don't know what to eat. I'm always bloated. I'm always tired. I don't know what to eat. And eating, incorporating healthy iftar and healthy suhoor to your fasting will change your life literally. I can speak of personal experience. I've had to go through a bunch of trial and error till I finally figure out what works for me and what doesn't work for me. So just really, and for me, I know once I finally have discipline around what I was eating for suhoor and for iftar, I honestly felt like I finally was fasting. I finally was fasting. I was observing this month of Ramadan. Before, I felt like I was starving myself the whole day. And when I'm having iftar, I'm eating everything in front of me. And I just don't think I was really practicing what the fasting should be about. I would just stuff in my face because I was so hungry. And I always felt like I deserve to eat, right? Because I fasted and this is my prize for myself. And it's just crazy thinking. I had to learn that does not work. That does not work. So remember why you're fasting, why we're doing this. And when you break your fast, just be cautious of the food you're choosing to eat. Also, I wanted to talk about good food versus not so good food. So for suhoor, you wanna eat food that gives you energy and keep you hydrated. For example, hard-boiled egg, oatmeal, yogurt, fruits. It's so important. I think this is the only, if we can eat only that in suhoor, I think we have enough, really. We just have to eat that and be mindful of the portion. I hope, an example of bad suhoor, I hope not offending anyone, but like qachafetfet, gahat, injera are not good. Do not eat it. Do not eat it for suhoor. People be like, oh, I like it. Well, I know it's something we like to eat with our family, but it's not going to do our body any good. They're not whole grain. It's all processed carbohydrate. And they do not have good nutrition to fuel our body and give us the energy we need throughout the day. We fast 15 hours. We fast from 5 a.m. and we don't break our fast till nearly 8 o'clock. So it's a long time. And if we don't make sure we have healthy food in, or we're eating the right amount of food, it's just going to make us sleepy, groggy, and feel heavy and bloated. And that's something we do not want to have. Remember, you want to be light and alert to be able to practice, to be able to practice our faith, read Quran, and do whatever we need to do to get closer to Allah. Good example for iftar. I'm big fan of roasting pretty much roast everything, but like roasting vegetable, roasting protein. Make sure you have salad. Salad are really important. Make sure you have a small salad. And again, as I said, wash your portion. Speaking of portions, so many people have a hard time with that. I use a couple things. So we always tell people to use this. If you guys ever want to use a measuring cup, that's actually a good place to start. Or you can use a food scale. I'm a big fan of food scale, and athletes use it all the time. So don't feel bad and don't feel weird. Bunch of athletes use it. I can give you names, but I'll message you guys later if you guys want to know. But people use it. If you ever want to use it to kind of monitor your portion, that would be a good way to go. Also, if maybe you're a type of person who're good in eyeballing. I'm not so good at that, but some people just know, okay, I'm eating this much. So good practice. We're always told in school to give patients like this much and plate. Like if you have a plate, this much food should be your vegetable portion. This is your protein, and this is your grain. And you should have like about 2 tablespoons of fat with meal, 2 tablespoons of fat. So that would be, just try to remember that when you're eating your meal, especially now, because, as I said, we're not only trying to eat, but we're trying to eat the right amount of food to help us practice. It helps us do what we need to do. Anyhow, you guys all know this already. People always tell me, oh, I don't want to eat sambusa, I don't want to eat makli, I don't want to eat whatever, but I want to eat it because it tastes so good. And I do get it. You want to eat it on the weekend, twice a week if you want to, but just eat it every single night for 30 days is not good. It's not good. I mean, think about it. You're not eating for 18 hours. You're fasting for the whole day, and then you're breaking your fast with fatty food. It causes you a lot of indigestion and acidity. So try to avoid it. Same thing with sweet. I mean, we have special sweet only for Ramadan. It's really funny to me, but you know, we're waiting for Ramadan to happen to make all those extra food and extra sweet. And sweets are amazing, they taste good and whatnot, but they have very low nutritional value and they have a very high caloric intake. So what's been happening is we fasting. When we break our fast, we eat so much food. So instead of us like actually losing weight, many people end up gaining so much weight, especially at this time, because it's still, the days are long and we're eating at 8 and we're going to sleep at 10, 11 o'clock. So it's not really helping. Last but not least, and this is very, very important point, eat slowly and take it easy. The food will be there. The food will be there. Take your time, take a deep breath, drink a cup of water, just eat and enjoy your food. And I think that's all I have for now. I hope that was helpful.
That was super helpful. Thank you so much, Maha. I loved your props. That was super nice to see visual aids. Thank you.
Yeah.
So mashallah, everyone seems to have covered most of what we wanted to talk about today. I just want to add a couple more things. So for those of you who are parents of little ones, Kawthar kind of touched on that the symptoms are similar. Something else that we do want to watch out for is congestion or nasal stuffiness or any lack of desire to feed. So if your baby doesn't want to nurse or take the bottle anymore, that's something that's should raise concern. You also want to make sure their temperatures are within normal. So for little ones, a low temperature or a high temperature can be a sign of infection. So you don't want their temperature to drop below 97.7 degrees Fahrenheit, and you don't want it to be above 100.3 degrees Fahrenheit. You know, first make sure it's not environmental. If they're over bundled or if they're just, you know, super exposed, then you want to make sure that that's not what's causing the reading. And then retake it in about 15 minutes. If they truly do have a temperature, especially with any of the other symptoms, call your pediatrician. If they do have any kind of change in color or trouble breathing, if you feel like they're working a little harder or struggling to get air in, please call 911. A lot of times the changes in color that we're taught is like a blue or pale complexion. For some of our babies who are like, you know, darker toned, darker complected, it's not going to be that. It's going to be more of an ashy hue to them. So they're not going to look pale. They're going to look more ashy, but it'll definitely be a change in their normal color. So the moment you see that, that's definitely the time to call 911. And so obviously, you know, don't take your child in right away. Call first, make sure that they know why you're coming, what you're coming in for, and they'll advise you at that time as to what to do. I can also talk a little bit about labor and delivery and the newborn experience in the hospital if anybody has any questions about that later on. And then I also want to talk about healthcare disparities. So unfortunately, we do have to deal with this. It's a part of our everyday lives. And then living in a pandemic just kind of intensifies that for all of us. As a reference point, pre-pandemic data from CDC shows that when compared with non-Hispanic white women in the US, Black women experience 3.2 times pregnancy-related death. So if you're over 30, it actually jumps up to 4.5 times more. And then the factors that would normally reduce this, like if you're college educated, if you're high income and your zip code, so those things usually would make you have a better outcome. For Black women with at least a college degree compared with white women with a college degree, the number was 5.2 times higher. So having a college degree, having a good income, living in a good area didn't really make that much of a difference for Black women, unfortunately. So that's the data that I'm more comfortable with, but I'll go to the recent data with the COVID-19 pandemic. So African Americans here in the United States are about 14% of our population, but unfortunately they're accounting for 40% of deaths here. And you know, increased hospitalizations and increased deaths. So in Chicago in particular, this data is like just even more alarming, just mind blowing, subhanAllah. They're 29% of the city's population, but they are representing 70% of COVID-19 deaths. So I think this is something that we need to take into account if, you know, we as, you know, providers, and this being something for us to be aware of, and then also for you know, as minorities, as people of color, something for us and our families to be aware of also and keep in mind. So these sometimes can feel like it's out of my control, but what can I do? these people are, it's what's called implicit bias. They just feel that way when they encounter people of color, and you can't really change that in this short span anyway. Or these are socioeconomic factors. There's out of my control. What can I do about it? So don't feel hopeless. Inshallah, try to gain control back. And one of the ways we can do that is by educating ourselves, by learning about the disease process. This disease is so unique in that it's always changing, subhanAllah. It's like literally daily, almost updates that we're getting. So it's very, very strange and it's very surreal type of life that we're living. But anyway, so educate ourselves, learn about the disease process, the symptoms, and what we can expect if, inshallah, if we, hope this doesn't happen, but if we do get hospitalized, what we can expect. And hopefully that can empower us and give us confidence. Also, I would like to suggest that everyone have someone who is close to them, like a parent or a spouse or sibling, or even just a close friend that kind of knows your health history, kind of knows what you know, your desires and your wishes and goals, and just can help you with decision making. And, you know, inshallah, that doesn't happen, but in the event that you can't speak for yourself, someone that kind of knows and can speak for you. Or just moral support, just someone to tell you, hey, you're not crazy, go to the doctor, you know. We kind of all touched on this. You can reduce your risk by eating better, moving more, cutting out smoking, wearing a cloth mask in public, and then of course washing hands and social distancing. And that last one is super, super hard to do. I think all of us kind of just, it gets harder with time, right? It just feels like it's when is it going to end? It's going on forever. Unfortunately, it does look like it's going to be here for a little while longer. I think the best thing we can do is mentally just prepare ourselves, know that it's going to go on for a little bit longer, give each other support, give each other grace, and just generally just give from ourselves when we're feeling like we're able to give, and then also be willing and allow ourselves to receive the grace when we need it. And then talk a little bit about our parents and our grandparents. Unfortunately, they might have some of the risk factors. They, you know, older, they might be 65 and above. They might have diabetes, asthma, history of heart disease, kidney disease, liver disease. So we do need to make them aware that this is serious. We need to be their support people. We need to encourage them to try to modify their, you know, their modifiable risk factors, like, you know, go out for walks with them, help them eat better, have iftar as a family together so that we're all kind of eating the same things, as Maha touched on. So subhanAllah, like, you know, COVID-19 happened, didn't mean the world stopped. You know, people are having babies, people are getting heart attacks, people are needing surgery. So we need to make sure that our parents are getting the continuous, the chronic, you know, care that they need, making sure that they're in touch with their physicians, they're getting their medications refilled. And then just kind of like encourage each other, be supportive. There's so much frustration, I think, related to the stress, our health issues, our finances, just being isolated. So reach out, as Kamal said, just reach out to people to check in, allow them to respond to you in their own way. Not everybody might be in a place that they're wanting to talk or willing to you know, to go back and forth with you. So just allow them that grace, and then when they're ready, inshallah, they will get back to you. I think that is all I have prepared. If you guys have any questions for us, we'll be really happy to take some.
There's a lot of questions, and I'm trying to not to laugh, but people are very funny. Trying to listen, but a lot of people are commenting about, like, you mean I can't eat stuff? Hey, I can't eat injera, I can't eat this. No, people, listen to the message. That's not what we're saying. You can eat it. Sorry, maybe I wasn't clear. You can eat it, but don't eat it every single night, and definitely don't eat it for suhoor. You want to eat it for iftar? Maybe, but not for suhoor. But yeah, I think it's probably a lot of questions. Maybe we can look at the questions people asking.
All right. Okay, so let's see.
Oh, Suheilah, someone is asking you, can you talk about the practice of visiting new mothers and newborns, and how long would you recommend not visiting unit until there's a vaccine?
Right, okay, that's a really good question, actually. So I think hospital policies do differ, but for the most part, hospitals are not allowing visitors into the newborn, maternal, postpartum units, labor and delivery. Some of them are not even allowing a support person. So it's just the, you know, laboring mom. A lot of them will allow the support person. So don't visit in the hospital. If you have to visit at home, please wear a cloth mask and, wash your hands and stay, don't hold the baby. Try to stay away from the baby if possible. New moms need a lot of support, and unfortunately this can be like super isolating for them and super depressing. So we want to not fall into that trap also of just isolating them. So visit with them if you can be on the phone or just kind of at a distance. If they need food or groceries and things like that, help them out with that. But just be mindful that the baby might be at a higher risk because of their, their immune compromise, so they might not be able to fight off the infection as well as we do. Alhamdulillah, so far we have seen that, as Kawthar mentioned, the risk to children and infants is a lot less, but we still just kind of want to make sure that we're preventing anything from transmitting to the baby.
Thank you. I actually have a question. Maybe either Suheilah or Kawthar, both of you guys can answer that. If you use a cloth mask, how are you supposed to, can you sanitize it, or are you supposed to wash it often, or are you supposed to change them?
No, those are good questions. So I would say the most realistic thing and easy thing to do is probably to use like a Lysol spray. The best thing to do is really to, when you're taking it off, you have to do it in a fashion to where you're not exposing or getting fomites on yourself to like increase that risk. So you kind of want to just make sure you're taking it off from back and like not touching the front of that mask at all. And if you can like hang it somewhere, that's something I would do, and maybe just spray it with some Lysol. If you can wash it frequently because you have a bunch of masks, then that's great too. But Suheilah, if you have any other
absolutely
thoughts.
I agree 100%. Just wash frequently. Try not to touch the outside of it. Kind of take it off from, if you have hijab, actually there are these really neat hooks that you can that you can use to attach it, so you don't have to go behind your ears. So that's neat, I guess.
Yes, I like that.
Can you guys also talk a little bit about cross-contamination? A lot of people are wearing gloves, and I think a lot of us, I even have to watch from that. I'm wearing gloves, I'm coming home, or I'm taking them off and then wearing them again. I'm coming home, and then I'm forgetting, I'm touching my hair, I'm touching my face, because I'm thinking I'm having the gloves is going to protect me, right? But please talk to us more about that, because I know you can have cross-contamination.
Yeah, exactly. So that's why it's tricky, because people think they have like protection on just by wearing gloves and masks, but like you're carrying around extra things to carry the virus. So you kind of have to pay attention to the actions. I think we're so habitual, so kind of have to watch what you're doing. So as soon as you are taking off the gloves, take it off from the inside out, so you're not touching the outside of it with your other bare hand if you took that one off too. And immediately just going to wash your hands from there, because otherwise you're just going to be increasing your risk, like you're saying, touching your hair and everything else. Suheilah, if you have anything else to add to that.
No, I agree with you 100%. Yeah.
I see one question here. If you're coming down with COVID symptoms, do you go to the hospital? What medicines would you need to self-treat in the home? I think those are great questions. So I would recommend, nowadays, I don't know how it is in the West Coast. I'm presuming that since you guys have Kaiser, it's big there, they're great system. They have telehealth, easily get access, and you can just talk to them about your symptoms that you're having. If the important things to really pay attention to is if you're having shortness of breath, you can't breathe, you're having chest pain, things that you feel like is out of your control, and maybe taking some Tylenol is not going to help. Definitely go to the ER immediately, especially for people who have asthma, that can worsen your asthma essentially. So if you have mild symptoms, let's say just headache, you take some Tylenol, seems to relieve it, you have body aches, you decide to reach out to your doctor. I wouldn't recommend going to the office. I would recommend just talking to them through the telehealth app if that's possible, or going to an urgent care, not necessarily an ER. And they could test you, or if you do it with telehealth, they can send you to a lab to get tested. I would recommend decreasing your exposure to other people during this time and assume you have coronavirus at this point. There's no point of just saying, oh, I don't know, because my test is not done yet. And a lot of times, you know, the sensitivity of this test that you're saying is like 70%. So they're missing about 30% of people who are negative, but they're actually positive. So it's just a matter of keeping yourself isolated and trying to, the things to do to treat, they recommend maybe is doing some vitamins, like I mentioned, vitamin C. Another thing is actually, so CDC initially said ibuprofen, Advil, Aleve, like those kind of NSAIDs are not recommended. It can kind of make it worse, but they took that back and they realized that's actually not the case. So you can take Advil, you could take Tylenol. I know some doctors tell people to just take Tylenol to be on the safer side, but it's really up to you.
There's a question for Kamal.
So I just wanted to add to Kawthar's point on there. While we're taking Tylenol, just be mindful that there's a limit to the dosage you can take in a 24-hour period. So try not to exceed that. I think is it 3,000 milligrams, Kawthar, is that correct?
Yes, that's correct.
Yeah, so try not to exceed 3,000 milligrams in a 24-hour period. But like I said, if it works for you, then you can take it for pain or fever.
Thank you. Question for Kamal about anxiety. I woke up 3 times from my sleep thinking I have the virus when I don't. I need your help. What do you do when you can't stop thinking about it?
That's a good question. So let me think. Let me gather my thoughts. So one thing, well, I don't want to just give off like a quick solution because everybody's different. And, you know, I don't know what her symptoms or this person's symptoms are. But generally speaking, what could be helpful is if you're having a hard time falling asleep is to get up and walk around. Don't try to force yourself to sleep, because what happens is when you force yourself to sleep, you're going to feel like this constant shame about yourself. Like, oh, I can't sleep. Something's wrong with me. Why do I think this way? And you get into this like vicious cycle. So what I would encourage that person to do is first just to get up. Either they could sit up off their bed or they could stand up or move around and maybe drink something warm, maybe warm milk to kind of, you know, settle down their body. I'd be curious to know what they're thinking in that moment. So I heard you say that they're thinking they have the COVID. So, I mean, that fear is everywhere. A lot of people are fearing this. So I want to just normalize that. And I don't want to say you don't have it, but the thing is you want to find out what's in your control. Do you have the control in that moment to know that you have COVID? Or is this something that you've just been thinking about constantly ever since this pandemic started? Again, you know, it varies from person to person. I can't really give a straight answer, but yeah, don't force yourself to sleep. Get up, move around a little bit. And I would also want to know, like, what are they doing throughout the day? Are they moving their body a lot? Are they getting enough socialization? What are they doing with their free time? There's just so many components to sleeping issues that it's really hard to say, you know, this person having sleep issues, then it means this and they have to do this. It's not that simple. So yeah, I would just be curious about what their day-to-day looks like and you know, help build off of that. And in terms of like the anxiety piece, one thing you can do to relax your body is something called progressive muscle relaxation. So this is very evidence-based, and it's shown to help ease anxiety. So you can look it up on YouTube. There's a lot of videos on this of tensing up your muscles and then letting them go. So like, for example, if you're, you know, having your fist, you could have your fist balled up tight. And then you can hold it, squeeze it for like 5 seconds, and then letting it go. And then you can do this from body part to body part. So then you could work from your arms, And then your shoulders, you can squeeze it like this for 5 seconds. And then relax it. And then you can do that throughout your whole body. If you want, you could just go on YouTube and they can walk you through it. Again, that could help with the anxiety symptoms, not so much the anxiety, but the tenseness that you feel with anxiety. It could help reduce that. So I'm sorry, I don't know if it was like a good enough answer, but yeah, I hope that was helpful enough.
Yeah, oh, go ahead.
Go ahead, Maha.
I was just going to say, maybe we can use the breathing exercise you showed us earlier. It was very helpful for me. So I'm sure if you wake up in the middle of the night and can't go back to sleep, maybe you should practice that.
Yeah, I think that's a great idea. I was also going to recommend making sure you're not watching the news as much, like to cut that off. And it's interesting to hear, like Kamal, you saying, depends what you're doing during the day. And I think a lot of times that's what's really affecting people and what they're seeing. And, you know, the news is on 24/7. And if you're like allowing that into your home, it's just constant negative things. You know, I want to stress that, yes, some people do get really sick, but most of the time, the mortality rate right now is about maybe 5% in the United States. This is a very small percentage. So I think that because we're constantly getting in this negative news, it kind of makes us feel very worried about, you know, this is doomsday. But in reality, it's not. It's just we need to take safe measures for those who are vulnerable at the end of the day.
I just wanted to add, I don't know if you guys, maybe you guys, Kawthar, Kamal, and Ma, have heard of the 3 Good Things study. So this was
I've heard of it.
Yeah, it was a study done on healthcare providers in the East Coast, I think. Duke, I think, conducted the study. So anyway, so they did this project where they had their staff write down 3 good things that happened during the day, at the end of the day. And so it could be something small to like, I got a parking spot at the hospital today, to like, you know, my favorite show was on and I cut it in. Whatever you think happened to you that was good, just 3 small things. And subhanAllah, within a 2-week period, they found that people that were experiencing burnout at work or anxiety, just kind of stress-related, work-related stress, and even subhanAllah, life-related stress, the stress is somewhat reduced. And then people who continued this habit on for a while, their stress was found to be reduced and they were able to manage their anxiety more. So I think maybe that could be a good idea during our iftar time, just kind of like a gratitude or mindfulness thing, just to say what are 3 good things that happened to me today, you know, with the kids or with your family, with your spouse, with your parents, what are 3 good things that happened, and kind of try the times that we have our iftar together for the 30 days and see, inshallah, what our anxiety and our sleep and how we'd feel at the end of Ramadan if we can incorporate that little, the thing, inshallah.
I think they call them the gratitude list.
I think I've heard of both.
Yeah, I think they're, yeah. This one is I think a little bit different, but yeah, that works too. I think that's something that we can incorporate. So even we can just start with one good thing that happened to you today, and try to incorporate that to our family iftars, inshallah.
I just want to add one more thing. Sorry.
Go ahead.
Before going to bed, like if you have difficulty sleeping, you shouldn't have your phone on at least like more than an hour, really. It'll help you not have that exposure to light and allow you to just naturally release melatonin and go to sleep. So that's another thing.
There's a question here. It says, from WhatsApp, we hear of lemon, ginger, orange drinks, and also black seed oil, garlic, and others to improve our immunity. Is there any truth to this?
Hold on, let me read. I hear all the time using natural product, definitely garlic. I've heard really good thing about using it. It's but I don't know. See, that's the thing is we have done, I would say ginger. Ginger is really, really good, especially at this time. So ginger, they have ginger shot in the store. You may use them. Regarding to black seed oil, orange drink, is that like an orange juice? Orange juice is good because it has vitamin C. Lemon, any citric drink is good. Lemon, orange juice would be good. Now, regarding to black seed oil, I actually do not know. There's always so many new things come up, and because the field of nutrition is a new science, really. So there's always new things come up all the time. Black seed oil, I do not know, but I would definitely say lemon, ginger, orange drink are good, and it's definitely going to improve our immunity at this time. If you have, a little bit allergy, if you're feeling you're coming down in a cold, so I think, yeah, you should definitely practice and use. I saw some question, and I was hoping either Kawthar and Suheilah answer. Someone says, many people in our community work with elderly in senior center, and those locations are known hot zone. What can we do to protect ourselves? That's one. And two, we still have to go to work, and I'm scared that I will get it and bring it home to my family. What protection is my employer obligated to provide me with?
Yeah, those are good questions. Suheilah, if you have any particular thoughts, otherwise I can go ahead.
Oh, go ahead, Kawthar.
Okay. Yeah, so there's a lot of senior homes that I've seen myself, also just patients coming in from different group homes or nursing homes where they are having coronavirus. And, as an ER resident, I'm always exposed to, I've been working in the last 5 nights on the coronavirus unit side of the ER. So most of the people I saw was people with coronavirus. Really, what you need to do is just make sure you protect yourself at the end of the day, that you're always washing your hands, that you're always putting on the protective equipment if you can. If your employer doesn't really have that to provide you those things, then I think, it is obligated that they protect you somehow. And if they're not, then, if you think you're somebody who's vulnerable, who has risk factors to even getting the severity of the illness, then maybe it's time to just step back from work for some time, or if you can afford it. I know that's another whole topic of things, but I would recommend just making sure that you have gloves, a mask on all the time, washing your hands all the time. When you get home, to decrease risk, just try to, strip down right when you get, not outside, but inside, just take everything off and just throw it in either like in a garbage bag or some bag that can just go immediately into the washer, and just take a shower. I think that those are the safe measures that you can do. And just trust in God that, He'll protect you. Because honestly, at the end of the day, the way I think of it is, if it's meant to be, it's meant to be. So you can do the most and be in a bubble. You'll still get the coronavirus if you're meant to get the coronavirus. That's how my perspective. So it doesn't necessarily mean it's the end of the world. You probably have a very high chance of doing just fine.
Someone is asking, is it helpful to take malaria drug for treating COVID-19? I wouldn't want to answer this, but you should.
So our hospital has completely dropped doing the hydroxychloroquine. What do you have to lose? You have a heart attack, maybe. You might just die from it. So that's what this study showed from the VA. It was a small study, but they actually noticed that there was a higher mortality rate from those people who are on the Plaquenil or hydrochloroquine. So I don't think it's the best drug to be on just yet. I mean, they need to do more tests and studies really to get a better answer.
And just know there's not specific treatment right now. There's no medication or vaccination for COVID-19. So we should not try to guess or think of something or like, oh, maybe this is going to work for this. If the doctor doesn't tell you, use this, just do not be creative. Like, just don't do it. Yeah.
We forgot to mention, just a small addition. We forgot to mention, if you are on the phone and you have a question, you can press *9 on your phone, and then we will unmute the line for you to ask a question. Again, *9 on your phone. If you're using the Zoom app, you can drop the question in the chat. Thank you.
Thank you, Akram. I just wanted to add to the last question about working with the elderly. So I know, like, just to kind of reduce our anxiety and feel like we're doing something to help ourselves and help our families, I think something simple that we probably all healthcare workers do anyways, just change your shoes in the car. So don't take your work shoes home, switch them out in the trunk. If possible, try and, you know, take off your outer work clothes. So what I personally do is I have my yoga pants or something underneath, and I just wear the hospital issued scrubs over that, and I leave those scrubs at work. If that's not an option for you, you can change at work, put your scrubs on there, and then put them in a sealed bag, and then come home and, you know, wash them separately at home if you're just kind of feeling anxious. But don't let it get to the point where you're kind of overdoing it and going to the other side where it becomes like more of an obsessive type of behavior. So just something that will make you feel like you're doing something, but not to the extent to where you're kind of losing control of it at the same time. I don't know if Kamal wants to add a little bit to that too.
No, I think you said it right. You hit the nail on the head. Prevention over paranoia.
Yeah,
you know,
exactly,
there's a fine line between the two of those things. We want to prevent. So that's something that's within our control. And once we start dwelling in what's not in our control, then that's when we get into paranoia, and we don't want to go there.
Exactly.
There's a question. Someone was asking about, I really want to address this because we're in Ramadan, and a lot of us want to see our family and our friends and want to invite people over. And there's this misunderstanding or misconception, well, I'm not sick, so I should be going visiting people. Maybe we can actually address that. Someone is asking, they said, it's hard for our community to socially isolate, especially during this time. Can you speak to the restriction around visiting others who are also self-isolating? If people are choosing to visit to take on family members, for example, what precautions should they be taking when they're leaving their home?
Yeah, I mean, one of the things I kind of do with my family is we use the house party app. So we kind of just get on there and just eat sahur together. It's kind of like being on Zoom all together and eat, which is kind of funny. The other thing I would recommend, like if let's say you were already tested, you already were sick, like over 2 weeks ago, over 3 weeks ago, on the safer side of things, then I think it's okay to go visit people. You know, they don't have evidence just yet that you're 100% immune from not getting reinfected. However, just knowing the physiology and the pathophysiology of your immunity and how it responds in creating those memory cells, then you should be able to protect yourself and others as well from being with them. But if you haven't been sick, you know, you're taking a risk going to somebody else's house. However, I would just pay attention to any symptoms that you have. Maybe you can have, family should probably check your temperature at the door. That's what some places are doing. It's hard because a lot of times, especially if you're young and healthy, you can be asymptomatic and be carrying the virus and you don't know. But it's just something to really think about. Is it worth it? And who will you be around with that time for iftar?
Are you also supposed to be a little bit more cautious if you have elderly in the house, like above 65?
Yeah, exactly. So like if you're gonna have older people at the house, maybe you shouldn't go over. Maybe do it virtually. I know it's not as fun, but it's just a thought to consider.
Thank you. That was very good. Kamal, I believe there's a question for you.
Oh, the exercise.
I'll put the exercise in there.
Oh, great. Yeah, so I'm looking at this question. Can you tell us why 80% of people who were in ventilators ended up dying? We don't know just yet. We don't understand why some people are just affected way more than other people, and like we don't know how many people can get by and be asymptomatic, but we think it's up to 50% at this point. But it's just a very few percentage of people who do get it. If they do get on the ventilator, you know, most of them don't make it. It has to do with the lung pathology, and they think that there's these risk factors of having some underlying heart disease, some underlying high blood pressure, causing you to have an increased risk of having a heart attack or heart failure related to this illness from the constant lung attack, essentially, that's happening. But there's, I'm very curious to figure out once this thing slows down and calms down, and for us to look back to actually see and determine why exactly this is the case.
We have a question on the phone. Last four digits, 5627. You can go ahead and ask your question. 5627.
Yes, thank you so much. This is a question for Kawthar. My question is, so how should we properly get home from like the grocery store after removing gloves and masks? Like how should we do it when we get home once we're done, like grocery shopping or whatever? Yeah.
Good question. So, I think the good things to do is once you get to the home, like right up front, I would recommend, first of all, that it's only one person who's doing the grocery shopping, as Suheilah mentioned earlier. And then maybe leaving the belongings at one spot, like all the groceries, and then essentially taking out the plastic bags, because nowadays I don't think you can actually use your own bags. So, and just getting rid of the bags, because there's some risk there. Some people may spray out the bags if they want to recycle them, but either way, the other thing is, some people recommend to make sure that you're washing some of your things that are in boxes, or if they're anything that's in plastic, just get rid of if you can. At that point, I would just put, make sure you wash your hands, put everything away, and then I would go ahead and just strip down everything appropriately. Like if you have a mask and gloves, so from the gloves, you want to take it from the inside out, and then you just toss it so you're not touching it from the outside. And then the mask, same deal, like I mentioned earlier, you take it from behind, don't touch the front part of it, and just throw that out. Some people recommend you can just probably hang your clothes maybe for a day, and you don't necessarily have to wash it. I don't believe the virus lives that long on like material. It's just the plastic. They said it was up to 3 days. And so that's another thing you can do. And I wouldn't really touch anyone else in the house until like you kind of wash your hands really well. And 20 seconds is what they say.
And I know we have a shortage of hand sanitizers now, but inshallah, if you guys have some, just leave some in the car or in your purse. And before you touch your car or open your car, just, hand sanitize before you touch anything inside the car.
Yeah.
There's a question on the chat. Can you speak also that being cooped up can affect family relations negatively, and how to deal with it? Fights can increase between husband and wife, also kids playing video games too much, and parents not providing alternatives, causing stress in the house.
Why are you guys looking at me?
Kamal.
So for me, I don't live with my parents. I don't live with my siblings. It's just me and my wife. But I can only imagine how stressful it could be having a whole family stuck at home together. Well, I think it's multi-layered. So, everybody has their own needs, has unique needs. And, I think like Suheilah covered it earlier, she said just to have grace, and to have grace with each other, and also have grace with yourself. It's really hard. Everyone's going to cope with this thing differently. No two people cope the same. One person might be trying to fix the problem. Another person might shut down or try to distract themselves. So, you want to come at it from a compassionate part of yourself, and know that everyone is dealing with this thing differently. Yeah, in terms of like logistics, kind of like what I said about structure, have your kids do something, have them be productive. not just to watch TV and not Netflix and eat Doritos the whole day, but do something creative together as a family. Create like an art project, do a workout together. Depending on the ages, you could watch something together as a family. You can even play games with them. Ask them what they're into, what kind of video games do they like playing. If you ask your kids those questions of like showing any interest of them, they will open up and they'll more likely be influenced by you. So this old school approach that a lot of older generations have of do as I say doesn't really work. So another approach to take is to actually show interest to your kids. Ask them, what are they doing? How are they coping? What's on their minds lately? How can you be of support to them? What can I do for you right now? You could take that approach as well. And just be creative with the whole family.
I also want to add one thing. I realized for me and for my family, sticking to structure was really helpful, like waking up at the same time, sleeping up at the same time. Like before Ramadan, we eat lunch at the same time, dinner at the same time. I think it really helped. But if you sleep anytime you want to, get up anytime, that's just going to add a lot of friction. So try to stick to your normal schedule as much as you could, and have structure.
Okay. We have one question about 80% of people, why a lot of African Americans are dying from COVID-19. And I was just giggling earlier because someone else put an answer because Popeyes are putting the virus in the chicken sandwiches. That is not the reason, sir. So subhanAllah, unfortunately, the reality is we all know we are a minority community. So we know that we suffer from institutionalized racism, systemic racism, implicit bias in the workplace, microaggressions, and those they build on us and they add up and they cause a lot of stress, a lot of cortisol elevation in the body. And so we're already carrying a lot of that tension on us. And then you're adding a pandemic to that. And then you're adding the socioeconomic and structural inequalities. So the air quality where you live, access to groceries, and then unfortunately also the susceptibility to other diseases, the other risk factors. So like you're more susceptible to heart disease, to diabetes, to asthma. And so when you add all of that together and then you're going into the hospital and subhanAllah, the person who's treating you is not believing that you're in pain or is not believing that you can't breathe. So that just is a recipe for a disaster, unfortunately. And like Kawthar mentioned, this is something that's fairly new. So there might be some genetic component to it as well that might come up in later studies. But for now, what a lot of the papers are saying is that it's mainly due to just racial disparity, healthcare inequality, unfortunately. So just something for us to be aware of if we ever have to be hospitalized, even if it's for something else, just to know that you might have to work a little harder to get across to your provider.
We have a question on the phone. Amina 18, you're unmuted. Go ahead.
Assalamu alaikum wa rahmatullahi wa barakatuh.
Wa alaikum assalam.
Thank you so much for all the speakers and all this, alhamdulillah, important knowledge you guys are giving to us. We're very grateful. So my question was during Ramadan, what kind of, this might be for maybe Maha because she's a nutritionist. What do you think is like one of the healthiest like food items that you think we can eat during, iftar, inshallah?
Well, I think I answered that question earlier, but the way I see it, I try to stick to as healthy as I can be. So for me per se, what I usually eat is I eat roasted vegetables. You can have beans if you want to, salad, fruits, yogurt, everything is okay. Just try not to overdo it with the fatty food and the sweet. So for me, for instance, this is usually what I eat for iftar. So I'll have so for tonight, for instance, I'll have I have salmon, and then I'm gonna have some roasted Brussels sprouts, and I'm gonna have some brown rice and some salad. That's usually what I eat. So always think about eating, as I was showing you earlier in the plate, eating a healthy meal that contain, carbohydrate, vegetables, fruit, and salad. And try to keep it as simple as you can. Just don't fill it up with sauce or salt or sugar. Does that answer your question?
She's muted right now, so.
Okay, well, I hope that answered that question. Is it clear? A little bit more?
Amina, does this answer your question?
Yes, thank you, Jazakallah khairan. That answers my question.
Okay, you're welcome. I have one more thing I want to add. Someone was asking earlier about, are you saying eating fatty food will cause me to have stomach upset? So what I'm saying is, if we fast 15 hours and we break our fast, we have to ease up to it. You just cannot go into the heavy meal. The way I think about it is, when you go to a restaurant, there's an appetizer, and then they give you like a salad or soup, and then there's an entree, and then the dessert. Try to think of it like that. For me, I'll have a small salad, and then I'll have my meal, and then I'll have a fruit afterward. Eating fatty food is not always gonna upset your stomach. Just try to eat it after you have something in your system already. It shouldn't be the first thing you eat when you break your fast.
Yeah, and I agree with Maha, just to like add on to that. So when you have something that's fatty, essentially like your esophagus that connects to the stomach essentially slows down in transit, and you just increase your risk of getting like acid reflux, like heartburn symptoms as well. And it just slows down your gut.
Someone is asking, is this a good time to get pregnant? Kawthar?
I mean, I guess so. You're at home. They're calling them the coronials.
Yeah, talk with your OB, your own personal health risks, and see what will work better for you and your family. If it's the best time for you, then inshallah, go for it. Just keep in mind that this might be here for the long haul, and just kind of you might not have as much support as you'd ordinarily have at a different time. And then someone else is asking, is it true we have to wash our groceries like milk, gallons, and frozen food? What do you guys have to say about that?
So my mom watches the news 24/7. She says yes.
I think there's certain ritualistic things that we do that, I mean, if it's not harming anybody, and why not? Wash your milk gallon. I think it's a good idea. I think it's a good idea to wash it anyway. If it's getting overwhelming, like you're feeling like I just can't keep up with all this, then don't. But if you feel like it'll make you feel better, then go for it. Just kind of similar vein also to the garlic and the ginger and all that stuff. If you feel like it's gonna help you, sure. If you feel like you don't get a sore, like I personally, when I drink ginger, I feel like I get less of a sore throat if I'm sick. So that helps me. So I think that, if it helps you, you're encouraged to do it. A lot of them are also like prophetic medicine. So that's probably, inshallah, will have an effect on you, make you feel better, as long as it's not interacting with your other medications. So just keep in mind that some of these natural medications can have an effect on your prescribed medications. So if you're on something that's chronic long-term, just kind of be more aware of that, and just kind of try, if you can ask your doctor. If he doesn't have an answer for you, then try to avoid it for the time being, because even if you don't end up with COVID, you don't want to end up with something that's going to put you in the hospital at this time. You want to avoid being hospitalized or going to the doctor's office at this time. So something new to your system, try to stay away from. Things that you're already used to, like garlic and ginger and the other things. I think it's okay if it makes you feel better. Another question here is, how long do you expect this will take until we can feel safe to go back to public places like work and college?
God can tell us that. I don't really know. I think I kind of addressed this where, the question is not when, it's how. So if we're essentially having testing done, figuring out who may be immune, they're more likely to be going out. keep in mind, given that we've been doing this social distancing, it is technically going to prolong this whole picture, because not everyone's together and getting infected very quickly, which is a good thing. We want it to slow down. But given that, it's still going to be around. So as soon as somebody a community just goes out back like nothing happened, it's just going to spike again and peak. So it's just a matter of once we know who is safe to really go out and who they can be around, and essentially really a vaccine at the end of the day. So however long that takes, they think it may be about a year.
I got a question for Maha of fasting with celiac disease or gluten intolerance.
Oh, celiac is very tricky because celiac are those people who their body cannot break down specific grain. So I will think of plant-based diet. Even that, you'll have to be really careful for the eating. Maybe I can have, it would be helpful maybe if I can talk to this person offline. I will need to think about it. I don't want to give you any information that I can't risk, because celiac is serious. So I don't know if I can maybe give that person or pass my email address if anyone want to approach me afterward. I'll just tap it here. Whoever that person is, please feel free to email me. And then we can talk about it offline.
That's good. Question for Suheilah. How do you approach a person who is not being safe for following COVID-19?
Oh, that's hard. If it's, I mean, I think it kind of depends on your relationship with the person and how you can talk to them. If it's someone that you're close to, you can just gently educate them, you know, a kind reminder. Hey, I mean, I think might not be the best time to go to this place. But really, I think ultimately, as we've seen with the protests in certain parts of the country, people want to go out and they feel like it's their right to go out. So you can't really, I think, stop anybody from going out or, you know, not following the protocol. What you can do is keep yourself away if you know that someone isn't washing their hands properly or covering, you know, their face, you know, putting a cloth mask on, or just going, you know, the only person you control is yourself. So you can just try to keep your distance from that person until until one thing happens or the other, until they realize that it's probably for the best that they follow the protocol, or until hopefully this whole thing goes away. I think we're done with questions for now. If you guys have any final thoughts that you want to share, if any other health professionals, by the way, are watching this, we encourage you guys to please send us your email address, join the EMC Health Board. We need more people. We appreciate you guys joining us. Please, please, please send your information. We're gonna post it, I think, right after this, so you guys can send your email, your names for all healthcare professionals, inshallah. But yeah, so you guys want to give your final thoughts?
Before we go into that, maybe Layla, can you say something? I think Layla had something to say.
Unmute me.
Yep.
Can you hear me?
Yes, we can hear you.
We can hear you.
I think they should go ahead and say the final thought, the speakers, and then I will just announce. Mine is announcement.
Okay, thank you.
Okay, I'll start, I guess. So I just wanted to add one more thing, essentially. If you are feeling sick, if you're having chest pain out of proportion, anything that is very unusual, I still encourage people to go to the ER. We've noticed that people have not been going to the ER and they ended up having a stroke a few days ago, and it finally came in because they were really trying to avoid COVID. But you know, it could have been prevented, or we could have reversed the stroke if they had come in sooner, or a heart attack or something like that. So I want to just stress that, hey, if you're having symptoms that are very unusual and very concerning, you should just go to the ER at the end of the day. But lastly, I just wanted to say that, you know, inshallah, you know, we'll all be safe. Just, we have free will and we should try to protect ourselves. But at the end of the day, also, we have Allah who, you know, has destined what is our fate, essentially. And just keep, you know, everyone in your du'as, your prayers, and inshallah, you know, we'll pull through with all of this.
Inshallah, thank you. Go ahead, Kamal.
Nothing much. Just want to say thank you guys for being on this panel with me. This is huge. This is something I never thought I'd be doing, but glad to give back in this way. So what I'll just do is I'll just put my email down, because it looks like there's people asking for emails from us if they want to have personal questions. So I'll just do that right now, and that's it. Thank you, guys.
Maha, do you have any final thoughts?
Sorry, I was just looking here. It's an honor and pleasure for me to be here. Thank you for all of you who tuned in and listened to us. We're happy to help you if you guys have any questions. I've already put my email in there. I'm happy to answer as much as I can. And just remember, I know it's Ramadan, I know it's hard, the social distancing thing, but we really have to practice that as much as we could. As Kawthar said earlier, have Zoom in your phone, download Party app, whatever it is, talk to your family through that. We really have to follow what the public health policy is saying to us now as much as we could if you want to get rid of this pandemic. Thank you.
Okay, thank you guys so much. Thanks to everyone listening. We appreciate you guys' questions. Alhamdulillah, it was so nice to engage with all of you guys. Actually, it was nice to hear the questions and nice to hear the other answers. I learned so much, and I feel so honored to be here. Thank the entire EMC organization, the health group, IT team, marketing team, our families. I want to shout out my son Munib and my daughter Rida. Hi guys. And truly, wallah, it takes a village, and alhamdulillah, we had an amazingly efficient response from the entire team. Jazakumullah khair, everybody who put in so much work to make this happen. And I think Auntie Leila, if you're ready to speak, okay. We're done.
Okay. Assalamu alaikum. Ramadan Mubarak, everybody. What a wonderful presentation. I really don't even talk after these speakers. MashaAllah, MashaAllah. I want to thank all the speakers, Kamal, Maha, Kawthar, Suheilah, all of you for preparing on such a short notice that you will to work with us and to give back to the community. I really appreciate it. You are an asset, a great asset to our community, and we'll keep doing this, inshallah, to make our community aware of any healthy issues that are going on, inshallah, biiznillah. And I invite all especially the young generation to health professionals to join our group. It's a wonderful group. It's growing, and we're doing a lot of exciting things, and be part of this, inshallah. The website will be posted at the end where you can call or send your messages how to join. And if you have any questions, you can send it there. Alhamdulillah. First, I would like to say Ramadan Mubarak to everybody. And this has been a special and different year with COVID-19 being an uninvited guest this year. But it's actually Ramadan came in the right time for us to give self-reflection and self-improvement, self-discipline. I think Ramadan came and we accepted it with the fact focusing to self-development holistically by praying, reading Quran, and by giving charity. And that's my point, talking about charity. I want you all to support our Eid and Ramadan campaign that is going on right now. Alhamdulillah, for those who already donated, thank you so much. And we start delivering the food baskets to the needy. I know it's a difficult time to even ask for this at this time, but there are vulnerable people behind us, our sisters and brothers in refugee camps, Eritrean refugee camps. And this is the least we can do. We probably cannot fix their problem or cannot take care of everything that they need, but at least to let them know we are there for them, and we're thinking about them, and we're making dua for them. So you know, everybody probably have the link, and you can go to EMC social media or EMC website to find it. And I would like you to make dua for first and the most, and share the link, and donate generously, and pass the word for anybody who is interested to be part of this good deed, inshallah. Barakallah fikum. Thank you so much. Akram, chairperson of EMC, is going to be talking a little bit after me also. Thank you everybody who worked behind the scene to make this program happen. It went a lot of a lot of work went behind the scene for this program to happen, and I'm really appreciative to be able to work with this great team. I'm really grateful for you, the marketing team, the health group team, and the EMC board general, and everybody who supported this this program. Thank you so much. Akram, you want to go ahead?
Assalamu alaikum. Can you all hear me?
Yes.
Yes.
Okay, awesome. So I just wanted to come on and say thank you to the panel. MashaAllah, this is a very insightful call. The ability to learn about the risk factors of COVID, the 4-4-8 breathing technique, better ways to eat for Ramadan, and then precautions around newborns, especially all those little tidbits here and there. We really appreciate it. We ask Allah subhanahu wa ta'ala to increase you all in knowledge and multiply your rewards for all the efforts you're putting in during quarantine, and especially during this Ramadan. And then I also wanted to thank everybody who attended. Inshallah, everybody learned something helpful from this call. I know I definitely did. And then lastly, I just wanted to thank the EMC Health Group for organizing. May Allah subhanahu wa ta'ala reward them for all the work that they're doing. And if any of the participants had any suggestions, or you just wanted to give your feedback, I believe we have the survey in the group chat on the side, and you could just fill that survey out, and it would definitely help the EMC Health Group for planning things in the future, inshallah. So again, I just wanted to say thank you to the panel, the attendees, and then the health group for organizing. And inshallah, we can see more beneficial programs coming out in the future.
Inshallah. Thank you all.
Thank you. Assalamu alaikum.
Alaikum.
Bye.
Assalamu alaikum.